Good afternoon, and it's my honor to speak here on behalf of my supervisor, Dr. Jing. And I'm glad to share the topic to you, the pathogenetic analysis of HPA axis regulated skin disorders, a new inspiration on related drug development. We all know that the skin is the largest organ of human beings, and it received all kinds of stressors outside the body. It may be a communicate organ to between the outside and inside organs. So it's easier to be changed. But the clinical investigation shows the mental stressors or the psychological stressor can induce or aggressive skin disorders, such as vitiligo, psoriasis. All of these disorders is diagnosed easy, but cure intractable. Through this, maybe we can treat the skin as a window to accept the environment stress and to reflect the inside organs change. So the skin diseases are not isolated. Through the structure of the skin, there's including the nerve endings and the blood. So the skin may be changed by the nerve factors or the other kinds of factors through the blood to the skin. Here is a new name called, we call it for the skin, neuroimmunoendocrine organ. So the skin can be changed by the neural system, immune system, and the endocrine system. So, there's to exist an axis. We call it a HPA axis. Here shows the work of the stresses outside. When stress on the brain, and it can increase the CRF. The CRF can be transferred to the pituitary to combine to the CRF receptor 1. Then it can secrete more ACTH. And ACTH can be transferred through the blood vessel to the adrenal and binding to the MC2 receptor. The result is the high level of the cortisol. But there exists negative feedback. It can work on the level of the PMC and the, thank you. It can both work on the CRF and PMC and the CRF to decrease the concentration of them. So there's exit homeostasis to make the steady condition. This is the what do we think? Maybe there exists another regulation in the skin. So the skin cells and the mast cells, the immune cells and nerve endings, they may be including the cycle like the HP axis to regulate the skin with the stressors, maybe UV. So what will happen with the stressors from the mental is our first question. So we designed the part 1 to investigate whether the mental stress is able to regulate the function of skin. So here's including 2 kinds of models, which is a depressed models. The CIS and the CMS both can cause the depression. The first is the behavior. The open field test, tail suspension test, and the full swimming test. All of them shows the stress from the mental can cause a depressed-like behavior. And this is the structure of the hippocampal. It shows the cells in both CA1 and the DG area. The cells is fewer and the structure is loosened. This shows the corticosterone level in the serum. It shows the CIS and CMS can cause the higher level in the serum of the corticosterone. It's higher. So after that, we investigate the pigment in the skin. So both of the CIS and the CUMS can cause the skin become whitely than the control group. This is a hair follicular, and also the CIS can cause and the CUMS can induce the follicular fever and the melanisome fever. So we want to suggest a new gas here. Maybe there's a lack HPA exit in skin. So the key factors and the receptors are expressed in skin HPA axis. So the CIH can be bound to the CIHR and increase the PUMC level. The PUMC first can be transferred to the alpha MSH and combined to the 1 receptor, and it is increased melanogenesis. The second transfer is transfer to the ACTH, binding to the MC2R receptor, and it also can increase the melanogenesis. So after that, the ACTH can be transmitted to the glucocorticoid, and it has like negative feedback, and to decrease the level of the PUMC and the CIH, which like the central HP axis. So when the UVR work on the skin, just like the stressor, and it can enhance the melanogenesis so our skin become much darker. So based on this, we check the expression of key hormone in the skin, and it shows the effect of the stress. All of the key hormone of the HP axis is much lower. So it shows the effect of stress is inhibit the skin HPA axis. And what is the stress on the skin compared to the UV stimulate? So here we do the first HP axis. The first shows in the control group, the UV can decrease the CIH and the PUMC level. But in the CUMS group, this effect is lower. So we can guess that the stress can make the lower reaction to the UV. It means the HPA axis in skin is weaker. After that, we study the key proteins of pigment system. It shows the MITF and the TYR, which are both the very important protein for the melanogenesis. Also, in the control group, the protein expressed is much higher when we give the UV. But in the CUMS group, the UV cannot change the expression of the two proteins. So it probably means the weak protection for our skin. So as I said before, that maybe it's induced or aggressive skin disease is caused by this reason. So the summary for first part, the CUS and CUMS, both of the depressed model, can make the central HP axis is in a hyper function.